Welcome to Helpful Hints for the chapter covering complications of pregnancy, childbirth, and the puerperium. This is just a medical term meaning that postpartum period. This chapter often feels a bit overwhelming for students, but please know if you end up coding for OB admissions in the real world, your employer would certainly ensure that you are trained at a high level of expertise. But for purposes of this course, we are going to keep our focus a bit more superficial, just to make sure you're understanding the basics, the fundamentals of this chapter. Let's start by discussing outcome of delivery codes. Whenever a patient delivers a baby or babies in the hospital, a code from category Z37 will be assigned. Z37 codes are used to indicate whether the delivery was a single or multiple delivery, and also whether the delivery was of a live-born or stillborn infant or infants. These Z37 codes are only used within the mother's record. Very important. They are never posted to a newborn's record. Z37 codes are also only used for the admission or the episode during which the delivery occurred. So if a baby is delivered outside of the hospital prior to the admission, so for example, we've all heard those funny stories of a baby being delivered in the car on the way to the hospital. We could not use a Z37 code in that instance. So they delivered in the car and then they show up at the hospital afterwards. We cannot use that Z37 code because the baby was not delivered within the hospital for that admission. Let's take a closer look at these outcome of delivery codes. So first of all, how do you find an outcome of delivery code? You begin in the alphabetic index of your CM code book under the main term, you guessed it, outcome of delivery. And then look at all of these subterms that we have available as options. We have single, live-born or stillborn, just one infant. We have twins, subterm live-born, stillborn, or one of each. And then you have all of these options for multiple births, all live-born, all stillborn, some live-born. So lots of examples. Take a few minutes this week to really understand your options here. Be sure to complete exercise 23.1 to practice with these outcome of delivery, these Z37 codes. As a quick example, delivery of a single live-born infant. This would be coded to the outcome of delivery, single, live-born, Z37.0. When you check the tabular list, so here we have our tabular list that we know to always check, you will see a note reminding you to not only use the Z37 codes, but to make sure it's only used in the mother's record. It is not for use in the newborn record. So we talked about that in the last slide, but here it's just reminding you in the tabular list. These Z37 category codes may only be used on the mother's record. Encounters for obstetric care or prenatal visits also include the use of a Z code. So taking a look in the alphabetic index under the main term of pregnancy, followed by the subterm supervision of. Regular prenatal visits when no complications are present are coded to pregnancy, supervision of normal in category Z34. Once you check the tabular, you will find options for first pregnancy versus another pregnancy. It also specifies the documented trimester within that code. So as usual, make sure you always check the tabular list once you find your code in the alphabetic index. However, I do want you to note that many pregnancies may be documented as high risk. If that's the case, please note that you will not be using a Z code for those prenatal visits. Instead, we again go to pregnancy supervision of, this time, high risk. All of these subterms here include codes from the actual pregnancy or the OB chapter, the letter O09 listed as the category. Many hospital encounters for deliveries are considered complicated. Take time to scan under the main term of delivery this week in your CM codebook. This is just a small portion here. There are actually several columns within the codebook describing complicated deliveries. However, there are certainly those deliveries that are considered plain old normal or uncomplicated. These are coded to the code 080. This code is found by locating the main term delivery in the CM index, and then there are a few subterms that will take you to this 080 code. Delivery completely normal case, delivery normal, or delivery uncomplicated will all get you to the same place. It is important to understand all of the criteria that must be documented in order to correctly use the 080 code for a normal, uncomplicated delivery. These criteria include the following, and please remember that all of these criteria come into play. There are many things to consider when we make that final determination if we can use this 080 code, such as minimal or no assistance, no instrumentation, no fetal manipulation, spontaneous cephalic, meaning head first vaginal delivery, cephalic or occipital presentation. These would not be permitted. These would be considered a complication. No abnormalities, no postpartum complications. With or without episiotomy is okay. So if a birth has all of these other criteria met and there is an episiotomy, that's okay. It's just a common thing to do during a delivery. And the last item here, outcome of delivery must be single live born only. So even if you have a perfect delivery and everything goes smoothly, multiple births are considered a complication, so twins or triplets. So again, the single live born only plays into that normal delivery criteria. This 080 code is always a principal diagnosis. It's always listed first. This code is explained at length in the handbook, so please spend a little more time with it this week and do that reading. Now let's take a look at weeks of gestation codes, or Z3A codes. These should be documented only again in the maternal record, the mother's record, to provide additional information about the pregnancy. This code may be found by beginning with the main term of pregnancy, subterm weeks of gestation, and after that it gets pretty simple. Each week has its own separate code. So take a few minutes and scroll through this week. It's pretty simple, and realize that we often need to pull in this code on our maternal records. Let's go ahead and take a look at an example from exercise 23.4 to pull in some of these concepts that we just reviewed. So here we have term pregnancy, 39 weeks, delivered, single stillborn, left occipito-anterior. This actually just means head first. These terms are actually described pretty well in the handbook, so make sure you take a look. And then we have terminal abruptio placentae. This just means the placenta prematurely detached from the wall of the uterus, and in this case it's terminal, meaning causing death. And then we have cord wrapped tightly around neck with compression. So right off the bat, we can tell this is not going to be a normal 080 delivery, right? We've got lots of things happening here. This is not a simple, normal, uncomplicated delivery. We have a stillborn. We have some complications. So let's start with the main term of delivery, complicated by abruptio placentae, which leads us to 0.9, and then we check the tabular, and this pulls in the last character 3 in the tabular list, which we are adding to indicate the third trimester. So again, check the tabular. Then we will pull in the other complication, delivery complicated by cord around neck with compression. These are all subterms here. The cord wrapped tightly around the neck with compression. This leads us to code 069.1. When we check the tabular, we pull in some placeholder values here because we are instructed to pull in the 7th character, in this case a 0. If you can't tell, this last 7th character here pulls in items that we relate to multiple gestations, but in this case we only have one fetus. So we will pull in the tabular, take a look, this 0, which is not applicable because we only have the single fetus. Moving along, we will then pull in the pregnancy complication code, pregnancy complicated by intrauterine fetal death near term, 036.4. Again, we check the tabular list, placeholders so we can include that 7th character. And then, because again, this is not a multiple, outcome of delivery, single, stillborn, Z37.1. And then we also had the weeks of gestation documented up here, pregnancy, weeks of gestation 39, Z3A.39. Now let's focus on PCS procedures for a few minutes within that PCS alphabetic index. Let's take a look at the main term of delivery, as this is our procedure, correct? Here you see subterms for cesarean, forceps, vacuum, manually assisted. Note that the subterms manually assisted and products of conception lead you to the same code. This is just a simple manually assisted delivery. On the other hand, the subterms of cesarean, forceps, vacuum, those subterms are telling you to code to the root operation of extraction. And then our body part character, when we get to extraction, in this case, is products of conception. This is the body part, which leads us to this particular table. So let's remember the root operation extraction. What is that definition? So remember, you always have these definitions with you in the appendix of your code book. Extraction is a pulling or stripping out all or a portion of a body part by the use of force. So the use of force would be the forceps or the vacuum to help assist with the delivery. Even a C-section involves that pulling out using force, even if that force is manually given. So again, extraction, the root operation, and then the products of conception will be that body part character for those extraction codes. Looking at the alphabetic index, remember it's telling us to go to extraction. So under extraction, you will note that the subterms here under products of conception, that body part, you'll find subterms for those deliveries that are using that stripping or pulling out, such as using forceps or vacuum, or even just high or low would be manually assisted. So take a close look, and remember, this is the first year in 2020. Usually we would have a subterm here for a classical C-section. That's no longer the case in 2020, but the handbook does a nice job of describing this. So if you would ever happen to see a classical C-section documented, just know it will be coded to high and open within the table once you get there. This actually would lead you to the correct code right here. So it might be a good idea to write classical next to this particular subterm. Let's take a look at a few examples for procedures from exercise 23.5 in your handbook. Our first one here, manually assisted spontaneous delivery. All this is telling us is that this is a regular manually assisted delivery. So we start with that main term of delivery, manually assisted, and it actually gives us all 7 characters there. Second example, vaginal delivery using low forceps. Remember, we start with our main term over here of delivery, and if it's forceps, it tells us to see extraction, products of conception, and then we pull in low forceps. And again, it's giving us all 7 characters there, which is nice. And then our third example, classical cesarean delivery. So again, if we start delivery, cesarean, it tells us again, see extraction. Extraction, products of conception, and as I mentioned earlier, if a cesarean delivery is documented as classical, we consider that high because they are extracting the fetus through the upper part of the uterus, through an open approach. High, and you'll notice the 5th character there is 0 for the open approach. So again, just to reiterate, this chapter can feel a little overwhelming, but if you narrow your studies to the items I discussed in the video this week, if you just focus on those fundamentals, the weeks of gestation, the outcome of delivery, those procedure codes, then you should feel pretty confident going into any quiz or exam. So happy coding. Post to the Coding Roundtable if you have any questions. See you next time.